Good morning, everyone. Thank you for all of those in attendance today, and especially to our wonderful board of directors and some of senior and clinical leadership. I greatly appreciate your commitment to ensuring excellence in all that we do here at Grace Hospital. For those of you here who may not know, my name is Sarah Burge, and I'm the compliance officer. Today I have the pleasure of speaking with you guys briefly regarding the moral right to health care as it pertains to our organization, and specifically 3 points we're going to focus on that will help us appropriately serve our indigent population within the community. So to start, or rather kind of orient around what we'll be talking about, I wanted us to look at our mission statement. And just as a reminder, Grace Hospital strives to serve as a center for excellence for our community in the provision of quality healthcare services for the underserved. So our organization recognizes and addresses the moral and ethical foundations to having quality, compassionate care for all individuals, especially those within our community. And as part of our intent for the upcoming year, the quality and compliance team, with assistance from senior management administration, have selected 3 elements for focus that we're going to have organization-wide, and it's going to require committees for review, implementation, and accountability. So by focusing on these 3 elements, we're going to strengthen our response to our community, especially in the way of delivering our high quality of healthcare. So our focus is serving the underserved, and the 3 tenets I want us to focus on are going to be code of ethics, cultural competency, and how we're allocating our resources as the hospital. Now first, the code of ethics, we're going to look at it and see how it relates to providing this care. Now, just for those of you who don't know, at Grace Hospital, we've adopted a code of ethics, and we actually ask each employee and medical staff member to sign this during the onboarding process, and as a part of annual compliance, complete an attestation that they've reviewed this. But far much more than an annual requirement or one that is done during onboarding, this is just on paper what establishes what we deem as ethical rules of behavior as relating to our patients, interactions with other healthcare professionals, and anyone within the community. So furthermore, it's really what it's doing is providing a compass for the direction in which we follow and points to where we want to head. So ultimately, as we're an organization that is striving to be transparent in all that we do and live out our mission, get our goals, meet strategic objectives, we believe in making it, putting it on the wall, putting it in our pamphlets, speaking it out, having it available for employees in the break room, just showing that this is what we value and emphasizing it accordingly. And of note that I thought was very interesting that just had happened in the last couple years, Hendricks Regional Health Center was striving for magnet status for their hospital. And actually, as a result of deciding to focus on a code of ethics program, it in turn transformed their whole practice of nursing and created a magnet culture. And in turn, there was greater participation for ethics committee consults. Professional organization membership went up significantly, and several individuals felt empowered to get higher levels of certification in their specialties. And what is even more, the patients noticed. They have made comments such as, "The compassion I was shown helped me mentally, so I have the strength to help myself physically." These are the types of changes we would love to see here at Grace Hospital. And to note, patient satisfaction surveys are going to be one of the ways we're going to be able to measure this. Now, secondly, we're going to look at cultural competence. And just as important as sharing our code of ethics and missions, it's the way we interact with our diverse patient population. So the question is, are we culturally competent as we should be? Now, cultural competence in and of itself for our organization is invaluable. Being able to care for individuals indiscriminately, especially the underserved, is a cornerstone to effectively delivering health care. So by doing this, there are links to patient satisfaction. If they feel that they are being understood and listened to and interacted with on a level that is understanding to their culture, it makes a significant difference. And in fact, a recent study in 2016 had shown that medical health professionals, those who receive training, any materials as a whole, but the ones that receive cultural competence annually, has effectively improved patient satisfaction in minority groups. So this is huge, and this is part of, along with organizational assessments that we have with the National Center for Cultural Competence, as well as patient satisfaction surveys. These are going to be the things that are going to help us see where we're at, but also ensure that we are delivering culturally competent care. Now, the third thing I'd like to discuss is how we're allocating our resources. So what we do with what we have truly matters. It matters for the organization, but overall it matters for how we deliver our care to our patient. So let's look on this more succinctly to look at improving our delivery, especially to those who need it most. So the reality of this process of resource allocation, especially in healthcare, is that there is oftentimes not enough to accomplish all that we want to do or all that's needed. In this case, healthcare administrators and even those who are present today understand that being able to ensure the needs of our patients, the community, and the organization, it's a taxing effort. And it's noted that although this is the case for, as I mentioned, the people in leadership, it's often impossible to meet everything perfectly. So given that we understand the scarcity of resources and sometimes the impossibility of this, while it's considered a daunting task, Gibson, Martin, and Singer note that the best lens to look through when doing all of this is one that considers ethics, economics, and evidence-based medicine, and that this is going to help us get the most clear picture of what we're trying to accomplish. And also another scholar, Kluge, acknowledged that while there are many frameworks we can choose to use from, we shouldn't favor just one. We should consider all those things, which further complements what Gibson, Martin, and Singer were saying. So, all in all, there are a lot of moving pieces and aspects to consider when we're allocating these. But interestingly enough, as we mentioned earlier in the presentation, our mission and goals that we have established is what we're going to come back to. What's important to us? While we certainly wish to take care of everything and wish we had an unlimited budget, the hard considerations must be made. So as we look at our budget for the upcoming year, we'll be looking at stats and reports for our EMR regarding prevalent comorbidities and issues that are being faced by our clinical departments. Do we note that nutrition continues to be a daunting conversation? Maybe smoking, other social situations? Whatever the barriers we face, we're going to do our best to put the resources where they're most needed. And so the goal of this committee is going to get involvement from social services as well as the people on the front lines, our clinicians, to get input on how we can best utilize these resources. So in conclusion, folks, today's presentation talked about the importance of our organization's code of ethics, our level of cultural competence, and our ability to allocate resources appropriately, especially as it relates to our underserved population, and furthermore, asserting the right of healthcare to our people. As we take this year to focus on each of these areas, we can drastically improve clinical outcomes and patient satisfaction as a result. As we continue to invest in ourselves and our organizations, our patients are the ones that are going to truly benefit. Thank you so much for your time today. I appreciate it. You can reach me by phone or email or after this presentation for any further questions. And just following these slides will be references from the materials used in today's presentation. Thank you.